Allison Odom, and I will be talking about mental illnesses. 46.4%, almost half of the population in the U.S., will suffer from a mental illness. These may be things like OCD, PTSD, bipolar, and borderline personality disorder. The ones I will be talking about today are general anxiety disorder, panic disorder, and major depression. General anxiety is described as the excessive, exaggerated worry about everyday events. They expect disaster and danger and can't control worrying about money, health, school, and work. They sometimes can be too unrealistic for the situation they are in, and their anxiety can interfere so much that it can take over their personal life. Some symptoms may be excessive ongoing worry and tension, restlessness, irritability, muscle tension, and headaches. They usually sweat and have nausea and a difficulty of concentrating. Some treatments may be cognitive behavior therapy, antidepressants, and anxiolytics. The cause, some people say, is the abnormal functioning of the nerve cell pathways to the area of thinking and emotion. If the neurotransmitters aren't connected right, they can change your mood and anxiety may appear. Some environmental factors that may make it worse is the trauma and abuse, death of a loved one, divorce, and change in job or schools. Major depression, in the 5th edition of the Diagnostic and Statistical Manual of Mental Illnesses, says that major depression is a depressed mood all day, more in the morning. It's a loss of interest in normal activities and relationships. Symptoms are usually present every day for 2 weeks. Some symptoms may be fatigue, feelings of worthlessness, indecisiveness, insomnia, hypersomnia, thoughts of death and suicide, and weight gain or weight loss. The hormonal change can happen during pregnancy, puberty, miscarriages, and menopause, and can increase the risk of depression. Men can also have depression, but it's twice as likely in women than men. Some treatments may be antidepressants, antipsychotics, anxiolytics, cognitive behavior therapy, and psychotherapy. Panic disorder can happen anywhere, and it's a sudden, strong feeling of fear and usually passes in 5 to 10 minutes, but can linger for hours. Some people say that it feels like a heart attack or a stroke, and most people go to the hospital for it. WebMD states that 1 in 10 people in the U.S. have panic attacks, and 1/3 of people have just one in their lifetime. 3% of adults have a panic disorder. Some symptoms may be fast heartbeat, sweating, shaking, nausea, shortness of breath, chest pain, dizziness, hot flashes, chills, and also the feeling of being unreal or detached, and a fear of going crazy or a fear of dying. Some treatments may be, are they sent to the psychotherapist, they do talk therapy, antidepressants, anti-anxiety medicine, and some lifestyle changes they can do are cutting back on caffeine, limiting alcohol, exercising, and deep breathing. So personally in my life, I've dealt with 3 of these, and I'm still dealing with 2 of them right now. I became worried and having anxiety when I was 12, when my grandpa passed away. Then 13 months later, my other grandpa passed away, and I was put in a depressed state. It takes over everything you do, and you cannot change anything, and you can't control it. So when you are walking down the street, never judge someone for what they are and what they do, and don't be rude, because you never know what they're going through. And my favorite saying is always be someone's light in their darkness.